So next question, a child received BCG vaccine but no scar developed after 6 months. What should be the nursing action? So suppose a staff has given BCG vaccine to a kid and he has not developed any scar. So we should not again immunize the child. We should not do anything because BCG is used for extra permanent TB till 1 year of age, and if he is not developing then there is no need to do anything. Period of population explosion in India. So ये पूछा था period of population explosion, that is 1951 to 1981. Now these are all the community based questions from 11. According to NFHS 5 2019 to 2021, net reproduction rate of India is 1.0, and the same question came from the same topic. Couple protection rate CPR is 66.7. So next question, unmet need for family planning referred to. So a lot of options was there. So the answer is women who want to delay or stop childbearing but not using any contraceptives. So second is the next is first function, primary function of Lakshya program. So what is the primary function? Is to improve the quality of care in labor room and maternity OTs. Now one image was given for mainstream CO2 sensor. ET CO2 cable was given, ET CO2 cable sensor. So what is the use? It is used to check the CO2 sensor, ET CO2 sensor. Now next, NG tube insertion they have asked. So what is the how we will measure the NG tube insertion from the nose to the ear and to the xiphoid process. Next, patient having Foley's catheter for 6 hours, no urine output. What will be the primary nursing intervention? So suppose if patient is having catheter and the output is nil only, so first we have to check for any obstruction. So we will check tube for kinking. Next, one image was given for wound dehiscence, and they have asked about what kind of dehiscence it is. Is it an early dehiscence or partially dehiscence? The answer is partially dehiscence. Which fluid is not safe for blood transfusion? So RL are not given in blood transfusion, and the safe safe fluid for BT is NS. Non-verbal patient pain assessment scale is facial scale. So patient is not able to tell about his pain, so non-verbal patient pain assessment scale will be the facial scale, which is also known as visual analog scale. Next is rectal suppository insertion length. So rectal suppository insertion length in adult is 2 inch, and if we count in centimeter it will be 5, and in children it is 1.5 or 1 inch. Next question, eardrop, most important question hai. So it was asked for children. So what we will do, downward to backward we'll put eardrop, and in adult upward to backward. Then one timeout question was there from OD checklist, and TPN question was abruptly stoppage of TPN leads to hypoglycemia, because usually what we will give 5D or 10D. Then pleural effusion sound, in pleural effusion sound will be dull sound. Drug calculation, desired dose by amount on hand and volume. So one question was there about drug calculation. Then one most important and most famous question, patient undergo thoracocentesis. After procedure, patient develops dyspnea and decreased breathing sound. Saturation starts falling rapidly. What is the most likely complication? So most likely complication is pneumothorax. Patient suffering from headache after LP, or one option was there maybe after spinal anesthesia. What is the nursing action? So we have to give supine position, because headache is because of increased ICP. So we have to post any surgery or post any anesthesia or post LP, we have to give supine position to prevent headache. Infant suffering from continuous vomiting during feeding, which is not appropriate action. So continuous vomiting during feeding, we should not give supine position. PEEP expiratory value decreases, which finding seen in patient. So CO2 retention, because if CPAP or PEEP expiratory valve will decrease, there will be hyperventilation, and hyperventilation leads to CO2 retention. A patient with below knee plaster reports the cast has become wet. So what is the nursing action? Use dryer on cool air. A patient with unilateral flank pain and abdominal pain is advised on ultrasound. What is the correct preparation? So we have to ask for fasting for 6 to 8 hours. A pregnant woman in active labor has fetal head visible, but it strongly retracts after each contraction. Crowning not maintained. So what we have to do? Extra help in hyperflex both leg.